Social Work at the University of Pittsburgh, and I am the moderator of our session this morning, which, as I'm sure you all know, is focused on funding collaborative community-partnered research. And we're really delighted to have a wonderful panel here that includes academic research partners, community research partners, and funders to talk through some of the challenges and benefits and ideas about how to successfully fund and sustain collaborative community-engaged research. And I am going to ask each of the panelists to introduce themselves and tell you a little bit about their involvement with collaborative community-engaged research, whether that's through an example of research that they're part of, or that they've funded, and also just as they do that to talk a little bit about how they even define this term. So I am going to, I think, just go right down the row. And here is Dr. Mary Ohmer.
Good morning, everyone, and welcome. We know it's a beautiful sunny day out in Seattle, which is not, doesn't happen much, and but we appreciate you being here and with us today. I'm with the School of Social Work at the University of Pittsburgh, and I work on both projects that we're going to talk about today. One funded by AmeriCorps, which Jason Beery is going to explain, and another one funded by both SAMHSA, the Substance Abuse and Mental Health Services Administration, and the Centers for Disease Control and Prevention. And I'll talk about the intervention, and Liz Miller, Dr. Miller, is going to talk about the comparison trial for that intervention. And it's an intervention to prevent violence in communities, and it's based on the theory and research on collective efficacy. And collective efficacy has been shown to reduce violence, and it's associated with less violence, improved mental health, improved health and well-being. And what the heck is collective efficacy, right? It is everything we've been talking about here in terms of the importance of relationships and communities. It is the relationships between young people, adults, and other members of the community based on trust, shared norms, and values. And when that happens, they're more willing to work together to intervene to prevent violence. They're more willing to address problems in their community, support young people, advocate for resources. And as used to be a community organizer, I never called that, never called it collective efficacy. But when I learned about it, I said, that's what I actually used to do. And look at this research. And, you know, we really need to do something to actually bring that science to the community and work with them to build collective efficacy. And so the intervention is really community partnered. We have community-wide partners. Dr. Beery is one of them. And we have community-based partners in each neighborhood and paid facilitators, residents who work with us. And we have 3 phases. We have a mobilization phase where we're in an organizing phase where we're getting to know the community and we're building relationships and partnerships, working with our partner and our facilitators on actually preparing for the next phase, which is a training for young people and adults. It's intergenerational, to actually build collective efficacy, and we do a community survey at the very beginning and end. We share those results with the community and in the training. And throughout that training, they're identifying risk and protective factors for safety and violence in their communities. And the young people lead the development of ideas for a community-based violence prevention project, which is the phase 3. And so some examples of projects are rehabilitation of a basketball court, a Cops and Hoops event. I have another partner in the audience, Cecilia Ware, who worked on a project in her neighborhood in the north side of Pittsburgh that really rehabbed a space that was unsafe, and we did an amazing event with the police, a Cops and Hoops basketball tournament. So it's arts classes, it's things, it's to actually alternatives to violence for young people and also for the community to come together to support one another as well as young people. So Liz, why don't you actually, could you talk about the how we're assessing the impact of this.
Yeah, absolutely. So good morning, all. Thank you so much for being here. Liz Miller, she, her pronouns. I'm an adolescent and young adult doc in Pittsburgh and have been in the field of sexual violence, partner violence, youth violence, community violence prevention, but also focusing much more on young people's strengths, community strengths, assets, and how we mobilize to prevent violence and promote thriving. And in that context, I've been doing community-partnered research for going on over 25 years now. And we're going to talk a little bit on this panel about strategies for funding. And this project that Mary was just describing, the Collective Efficacy Intervention, was funded by the Substance Abuse and Mental Health Services Administration, SAMHSA. And SAMHSA, because the emphasis is on funding programs, this was a strand of dollars that emerged from the pandemic to support community mental health and community resilience building. But because it's SAMHSA, there's very, very little dollars for evaluation. So we had an opportunity to apply to the Centers for Disease Control and Prevention to actually do a rigorous randomized control trial of this intervention. And so the comparison is health and wellness education sessions, also occurring in comparison neighborhoods, very similar to the neighborhoods where we are implementing the collective efficacy intervention. And those health, and the idea here is that when you do research with community, it is vitally important that you also think about what the comparison intervention should look like, what and how we can actually address community needs and still build connectivity while not, quote unquote, messing with the collective efficacy intervention. And so designing the comparison was also done in partnership with community partners. And we're just doing a series of kind of health topics that are community driven and pulling in university partners. So it's another strategy for building research practice partnerships as well. So just go down this way. Yep. To Joyce. Okay, perfect.
Good morning, everybody. My name is Joyce Dieterly, she, her pronouns. I work at Centers for Disease Control and Prevention and the National Center for Injury Prevention and Control, or the Injury Center. I sit in the Extramural Research Program Operations Office, which is the focal point for the Injury Center's funding for extramural research. We also support extramural research for the National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry. So part of our work with providing funding for extramural research is supporting the mission of the Injury Center to prevent unintentional injuries and violence-related injuries and to minimize consequences of injuries when they do occur. So as part of that work, every year we release notices of funding opportunities for specific NOFOs, and I want to highlight a few that we've released in some past years that are really focused on community-engaged research. And so we have the work that is going on with the University of Pittsburgh as part of our research for the rigorous evaluation of community-based strategies to prevent research. We also have just recently in the past year released a NOFO that we've awarded several awards for identification of community-based strategies for overdose prevention. That's the first time we've released that specific NOFO. We're very excited to see the work there. And also there's opportunities for investigator-initiated research. Every year we release notices of funding opportunities for overarching violence prevention and injury prevention related topics that we accept investigator-initiated applications related to those topics in violence and injury prevention. So we're very excited to have funded several awards for the youth violence research centers that do have a lot of community engaged partners conducting the research. And yeah, that is a little bit. I'll pass it to Chris to talk a little bit more.
Thanks, Joyce. Good morning, everyone. Thanks for coming. My name is Christopher Allen. I am a behavioral scientist in the National Center for Injury Prevention and Control, in the Division of Violence Prevention, in the Research and Evaluation branch, on the Youth Violence and Emerging Topics team. Yeah, thank you. So what the behavioral scientists in the Research and Evaluation branch do is specifically for funding opportunities which are given out as part of what's called a cooperative agreement. And the way the cooperative agreements work are that the researchers who are selected for funding are partnering with CDC to conduct their projects, right? And so in those instances, they are partnering with a CDC scientist, in this case, I'm one of them, who meets with them and chats with them and supports them on whatever work that they're doing. So I have the privilege to work with Dr. Ohmer and Dr. Miller on the intervention they were just talking about, as well as several other projects that are funded by the Injury Center that are kind of housed on my specific team.
Okay, good morning, everyone. Thank you so much for coming. I have some handouts because I was not allowed to have a QR code, so they're by the camera over there if you didn't get it. Before I start, though, I really just want to take a minute to thank the conference organizers and Dr. Mary Ohmer, because this is such a great topic and such an important theme, and I've been going to some of the sessions around collaborative research, and I'm learning a lot from hearing from everyone's research and what it means to work in communities. And I'm more convinced as I leave this conference that this approach is transformational and can be transformational. So anyway, thank you so much for bringing attention to this work. And so I work for AmeriCorps. Has anyone served Vista, AmeriCorps, City Year? Oh, good, yay, we have, a couple people, great. So I always start, it's hard to talk about AmeriCorps because it is a single agency. It's a small little agency. We are not under any layers of other federal agencies. But people say, well, what does AmeriCorps do? And really, I hate to say this, but it is the domestic Peace Corps. A lot of the programs have been around since Kennedy and Shriver. But as an agency, we're only 30 years old. And what we've done is combine all the national service programs. And it's for any age. I would say maybe some people are younger than 18, but 18 until you can't serve anymore. So we have a lot of seniors that work in our programs as well. And so we have summer programs that are more useful for for people who are in college or for people who do not know what to do and not want to go to the college route. A lot of people join and learn skills and so forth. And if you're older, you get to bring all your experience and knowledge and find a way to get connected and really pay that forward. So anyway, that's what AmeriCorps is. It's really to strengthen communities and to increase civic engagement or really thinking about our democracy and what it means to participate. But I just want to start, and I am a funder, I'm here as a funder, but I want to start talking about the journey, because I think when people see or hear about a donor or a federal agency, it's this like castle, you don't know how to reach it, you don't know how to talk about it, you don't know who's there, it's just like the donor, the agency, and so forth. And so I just want to say that I think my colleagues and I have gone on a journey, and we ourselves, I'm a sociologist, something that we did before coming here, and we saw it as an opportunity. And I think this work is a collective, right? It is knowledge that everybody brings depending on who they are and the kind of resources they bring together, and all together we can make that kind of change. And so my first master's was in international development at American University. Anybody here from American University? So I don't say anything mean? Okay. No, I love American University. But, we learned a lot about failed projects, and I'm sure in social work you do the same. Lots of development projects that had nothing to do with community needs, a lot of, failed projects in the sense that people did not use those projects, or in the worst case, that people's lives were lost due to those projects. And so there were two major issues. One was research, bad research, non-existent research. And the second was there was no community involvement. And so, you'd have a program for girls, and girls were never asked their opinion, were never included in the work. And so I kept hearing about this kind of grassroots approach where you could bring people in, but I could never find someone who could teach it. So anyway, I went off to sociology thinking, okay, I'm going to learn about research, and it's about changing the world, so I'm going to go there and learn about this. And so I did learn a lot about research, about quantitative, qualitative methods, analysis, research designs, but there was no one in the department who could teach me how you do this work collaboratively. And in fact, it was pretty much marginalized, right? I was told, you maybe want to keep this out of what you're doing. But because I'm stubborn and I really believe in trying to learn how to do this work, I kept going. And I met a woman who had been doing this work for years, and I just glommed onto her and put together some workshops at the university, and it was really well attended by faculty and by students. And then I got to go with her to Madagascar, and she taught us work. I was there for a year, came back, did more of the work in urban, rural, suburban areas, and the work was always messy, and it was always lots of failure and lots of joy and everything people have been talking about. But it was always one at a time, right? One community at a time. So I was really eager to find a place where this could be more of a social movement. How do we fund this in a greater way? And so this opportunity came up at AmeriCorps in the Office of Research and Evaluation. And because the mission of the agency is to strengthen communities, I thought this would be a good place to do it. And so 10 years later, we have managed to put together a funding opportunity. Dr. Mary Ohmer is one of the grantees, but so are a few other people at this conference. And we believe in 3 principles. And again, this does not come from just something we made up. It's my experience, it's my colleagues' experience, and really thinking about how do we bring in marginalized voices, how do we share in terms of power, how do we bring in, all the things that Dr. Desmond Patton talked about yesterday. So anyhow, the 3 things that we really focus on are, community engagement. That's the first one. I think the handout has that. The second is really thinking about research in a more systematic way. We don't care the methods, non-traditional, traditional methods, whatever works for that situation, and action, that we see the action that's coming out of that. And again, we believe that community engagement is part of this, but we also see more of that, and community engagement does help to strengthen communities. So that's the vision.
I'll take this. Okay. Good morning, everyone. My name is Jason Beery. I am here in a dual role in this session. I am on 2 projects, one with Mary and Liz, the RECAST project, and then also an AmeriCorps-funded project with Mary as well. And I'm going to talk right now about the AmeriCorps-funded project. And so in this role, I am the director of a network called Equitable and Just Greater Pittsburgh, which is a network of over 200 organizations, community groups, residents, other professionals from different institutions who all come together to advocate and advance equitable and just policies, practices, and programs for Greater Pittsburgh and Allegheny County. And so the project that we're working on now kind of grew. It is an AmeriCorps-funded Office of Research and Evaluation, Civic Engagement Research Study. And it grew out of some work that Mary was doing a few years ago called Research for Equity and Power, where she was working with a few communities in the city of Pittsburgh to work on bringing people together to advance equitable development in their neighborhood and thinking about what that means for their neighborhood and thinking about how they can work together better to really create change in their neighborhoods. A couple years later, there was another opportunity to build on that work, and Mary reached out to me, and I've been working with Mary for a while now, and so she reached out to me and wondered if we could do something with our Equitable and Just Greater Pittsburgh network. And it was a really great opportunity for us because our network's been around for about 5 years now, and very early on, within the first year, one of our steering committee members, who's a community advocate, said, what we need more of is we really need to be focusing on leadership development. We really need to be building the next generation of community organizers, community advocates, because some people get burned out really quickly because it's really tough. And some people, if you don't burn out really early, some people just stay in that role for a very long time, and they don't necessarily develop the next generation of leaders behind them. And so we really wanted to think about how we could do this together, how within our network, how we could really support leadership development at the community level, and then also with Mary, how might we be able to create a research project that actually does that. And so what we did was we built on the work that Mary had already done, and there was some additional funding in our initial grant from AmeriCorps to continue Mary's work in the individual neighborhoods. And then we added on another component, which we have called the advocacy and organizing training. And this is a training that we put together, and I will say this is a research study, right? I think we try to make it research light for our participants, but it is a research study, and we're really evaluating how the impact of this training and this project on civic engagement and civic participation. And so what we do as part of this training is we invite residents from across Allegheny County who either are new to community organizing altogether or who are already involved in their communities but want to get connected to wider networks across the county and wider campaigns that are doing things more regionally. And so we invite them to participate in a 7-week training program, followed by a project implementation phase where they work together to identify a project that they want to work on together, and it has to be a project that affects all of their communities together. Right? So it can't be just a park in this one neighborhood. It has to be an issue that affects them all. So our first year we worked on housing, or affordable and accessible housing. This year we're working on access to mental health in the Black community in Pittsburgh. And so with those two phases, one of the things that we also do is we draw from our Equitable and Just Greater Pittsburgh network and bring in experienced organizers and advocates working on different issues to talk with the individual, or talk with our participants and really give them a sense of the work that they're doing, what campaigns they're working on, and just some skills that could be useful for them for our participants as they work to build their own skills. And then in our project implementation phase, we also bring in additional advocates to support that work. We usually try to have one or two that stick with us for the entire time that are really relevant for that particular topic area that our participants choose. And so throughout this process, we have a few points at which we gather information from our participants. We have a survey at the beginning, and at the end, we conduct focus groups. And I should say we also have a steering committee made up of experienced advocates and organizers. In our first year, that's what it was. And in our second year, a lot of our first-year participants wanted to join the steering committee, and so they did. So we now have a much larger steering committee, but we have more, and we also survey and talk with them in little focus groups to get their input on the program itself and to get feedback on, and for research purposes, and also just as a good feedback loop for us to better understand for quality control purposes and how we can make things better and more useful for our participants. And so I'll stop there. I think that's good. Yeah, thank you.
Last but not least, my name is Kathi, Elliott. I'm the CEO of Gwen's Girls, and we also convene the Black Girls Equity Alliance in Pittsburgh, Allegheny County. Thank you for inviting me to join this panel. I was asked to join to represent the community partners and the perspective of community working with different universities and entities that oftentimes don't look at community as partners. And as you heard from folks that have already spoken, this is a change, and it's only been over the past few years, but it is a welcome change, because in many communities, research and participating with research as well as universities has been something that we really didn't want to do just based on history, and I won't go down that path. but it's getting better. And so one of the things that, well, let me just first tell you a little bit about Gwen's Girls and the Black Girls Equity Alliance and how it ties into what was just presented. We are a nonprofit that serves approximately 100 girls per day across 3 program sites in Allegheny County, Pittsburgh. Our main program, as I said, has been after school, but we also do community-based support as well as in-school support for girls from ages 8 through 18. We provide services to all girls and people who identify as female. However, we do have some recent programs that actually impact all youth, and so I'll talk about that as well. We also have looked at well, Gwen's Girls was started 22 years ago now by my mother, who was a police commander in the city of Pittsburgh, and she often came across families and girls who needed additional support, but there really wasn't anything that did not involve them in the system, whether the juvenile justice or child welfare system. So after serving 26 years, she founded Gwen's Girls. And so, you know, when unfortunately she passed away in 2007, and the founding executive director kept the organization going, and then in 2012, I accepted the position of the CEO. And one of the first things that I wanted to look at was what was happening with girls in our region and even nationally. And so that meant looking at the data. And prior to my coming on, they had, the previous executive director had looked at working with the universities to look at the data, because obviously we're a community-based organization and research isn't something that we were well vested in. And so Sara, Goodkind, and a few others were meeting to understand what was happening with girls in our region. And at the same time, there was a lot of focus on what was happening with Black boys, and the funding was going primarily to them, and the research was focused primarily on Black males. And so Sara was commissioned by 2 of our local foundations to do a very rigorous data analysis around all the different work that was going on in our region that impacted girls and young people in general as well. Because one of the things that we kind of pride ourselves on is that when we look at our data or look at the data and do reports, it's not just focused on gender or just race. We also include disabilities so that you can see the differences that are of the impact and also the disparities that exist. And so Sara, and one of the studies that was part of the analysis was with the health department and Dr. Miller, and looking at the Healthy Teens, Allegheny Teen Survey. And so Sara compiled all that information, and that ended up being our first kind of publication, per se, of the inequities of Black girls in Allegheny County. And then we had a summit that called on all the different leaders from those systems to say, or, you know, kind of give us some insight as to, do they understand what the problem is, what the disparities are, and then what are some of their goals to address those. So after the summit, we started convening meetings, and we were, you know, I was pleasantly surprised that we had over 70 people show up and continue to show up to address the inequities that impact Black girls in our region. And that led us to giving it a title, so it's the Black Girls Equity Alliance. This year we'll be celebrating our 10th year anniversary, which we're so happy about. And so, thank you. So if you go to our website at gwensgirls.org, you can see information about not only our organization, but the Black Girls Equity Alliance. And the work that we've done several publications on the various areas where we know that the disparities exist. But one of the other things that ties all of this together for us is that Sara and another faculty member that's at Point Park University in Pittsburgh, Dr. Brittany Brinkman, we were fortunate to be fellows with the Robert Wood Johnson Foundation. And that allowed us to look at participatory research with our young people. And so one of the things that was mentioned is oftentimes we know that research and programs and projects are done, but don't have the folks that are the most impacted at the table have an input as to what some of those not only issues are, because, you know, I often say I feel like I'm old, but by the time we find out something, the young people have been, it's 2 years in existence. We're late. So they can be at the table with us telling us what is happening and to try to be proactive in addressing those issues. And so that was what our project was about. How do we engage young girls, and particularly girls of color, to inform the work, be a part of the work, be leaders of the work, to, you know, train them and teach them in some of the things, because they train and teach us too, right? But some of the skills and things that they need to be the next generation to help us to, again, mitigate some of the issues that we often see that are generational in our communities. And so that has been led to the creation of the Black Girls Advocacy and Leadership Alliance. And so we've been meeting with them ever since we've gotten the fellowship. And I'm gonna stop there because I know one of the questions is, how do you keep it going when the funding is over? Because that was a 3-year opportunity. And we still, as you heard me say, this has been 10 years. We probably have done an additional 3 years with some additional support, but it's important to make sure that you have a firm foundation and vision for whatever you're going to create, so that when you do talk about succession and sustainability, it's not just about the funding. Because I was saying to Sara, like, we'll do this work without even having any money. We shouldn't have to, but that's the key thing too, is that, you know, the investment isn't just about the financial piece. So thank you again for being here.
Yeah, well, so thank you, panelists. And so we have a few more questions for the panelists, and this time, not everyone has to answer all of the questions, and there's no order, so just sort of whoever feels they have a response. And then we also will have some time to open it up to questions from the audience and some discussion with you all directly. The next question is for our funders. Whoever wants to talk. So tell us about a challenge that you've faced with regard to funding community-engaged research and how you addressed that.
Okay, I can start on this. I think it's going to be of no surprise to anybody that financial side is always a challenge. Even on the funder side, a lot of times we don't know what our appropriations is going to be from Congress year to year. And so that does present some challenges with us in planning for how many awards we can fund, what we can offer, and that prioritization within our injury center of what we can do. And it's been really great to see that prioritization of community engaged research in what we are able to fund, and just knowing that we are, as an agency, committed to keep funding this work. And we have folks, Dr. Allison Arwitty consistently goes to meet with congressional leaders to advocate for the continued funding within the Injury Center. Another challenge that I think that we recognize is that a lot of our funding opportunities are very time limited. The way our funding usually works is we are limited for funding opportunities between 3 and 5 years, and recognizing that this type of work, like you were saying, it doesn't end at the 3-year mark or the 5-year mark. And so we understand that these community partnerships keep going, and it's we have one of the challenges is to, how can we write an opportunity that's going to have impact with community partners within the community with our funded partners. And so one of the things that we really encourage, if you're thinking about going for this type of funding opportunities with community engaged research, is just having that established partnership, I think, before going for applying for a specific funding opportunity, just because knowing that it just takes some time, and 3 to 5 years to conduct that research is not a lot of time if you are trying to establish partnerships within that funded time frame.
Yeah, just to piggyback off what Joyce was talking about, I think additionally, some of the things to keep in mind would be that specifically when we're thinking about engaging community partners and community organizations and doing this type of work, from the funding perspective, there isn't a lot of research on what exactly are the resources that everyone needs to do this work efficiently and effectively, and also with fidelity. So if you're thinking about going after these types of funding opportunities, it's really important that in your application you make a very clear case for the things that you're doing and why you're doing them. Most notably, when you're including community partners, having a very clear description and outline for who's doing what and when and how is also very important, so that the organization can see that if you're saying you're doing community research, then you're actually doing community research, and those community partners have as much of a role on the table as the researchers do. And then I think the last thing I wanted to quickly mention is that we all know in this post-COVID era that sometimes challenges happen, and that's totally okay, right? And from the funding perspective, that also means that when things happen, you still have to have a backup plan, right? Because the research still needs to get done somehow. So in your application, you definitely want to make sure that you've talked about either contingency plans or really highlight the time and nature of your partnership with the community organizations or the community partners, so that the funder has a good sense of, okay, if there's a hiccup, they have the relationship, they have the social capital amongst themselves to get it done.
Thank you. I second everything Christopher and Joyce said. I do think it's super important. I mean, when we were getting these together, we were really trying to figure out how we were going to sort through all these grant applications and look for more authentic, collaborative relationships that had been ongoing, not just because there was a grant opportunity. And so we also made sure that we looked for how long, some letter of support from the community partner, how long they've been working together, what their goals were, and what they had done. But more importantly, I think our major challenge in trying to put this together is we had a vision as to what we wanted to fund, but we had to work with our attorneys, I still remember this, trying to get them to understand that we wanted community researchers to be paid a living wage. Not just a little stipend, not just, so if people were gonna be working, full-time or part-time, that they were paid a just wage. And that took a lot of negotiation. So I'm just pretty proud that that's in there, and I've heard from our grantees of what that meant to them, like to go back and really think about that with their community partner, and not just have like a little stipend, but really knowing that this is valued work, and we always know that community members who could least afford to have to do another volunteer opportunity are always being asked to volunteer that opportunity. And if you have a job or you're an academic or you're a federal worker, we get paid for this. So how to think about that to try to do something around the equitable nature of the grant.
All right, thank you all. The next question is for the academic and community researchers. So can you describe a successful strategy with regard to funding your community engaged, community partnered research?
So one strategy that you heard me allude to earlier, which is the community resiliency, collective efficacy work that Dr. Ohmer is leading, we were funded programmatically by SAMHSA, and then are building the research with Centers for Disease Control and Prevention dollars, right? So this idea of kind of braiding the funding together to do the work is incredibly important. It is super challenging on the back end because you have to remember what parts of this were funded by SAMHSA and are we reporting to SAMHSA, what parts were funded by the CDC and are we reporting to the CDC, right? And I think one of the key things about the cooperative agreements with the Centers for Disease Control and Prevention is that Mary and I get to work shoulder to shoulder with Chris. And so that ability to say, we're being super transparent that this was an already funded project that we are now rigorously evaluating. And it turns out that our SAMHSA program officer and the folks at the CDC are super happy with this, way in which we're actually bringing these opportunities together. So one of the things that we get to do as community partnered researchers, right, is actually doing that kind of connect the dots and braiding funding. The other piece of this puzzle is that you heard Joyce talk about and Chris talk about and Andrea talk about is that it is really important to think about sustainability at the start of any of our partnered work together and how we will use the research evidence to drive that sustainability. So one example of this for us in Pittsburgh is that coming off of some of the research that we've all done together around youth violence prevention, sexual violence prevention, dating violence prevention, has been giving those data to Allegheny County Department of Human Services and then sustaining the work beyond the research funding with county prevention dollars. And so one of the things that I think is that we have an obligation as sort of scholars in this space to always be thinking about how we return research results, of course, to participants and community members, but also to the decision makers in our local communities to help them use their dollars, right? And so it is this use of research evidence, I think, is a really critical piece of the sustainability story. And we get a very substantial amount of funding through the county that then is further funding that is allowing us to pay young people for their time to participate in some of our prevention programming, for example, which is not readily built into the SAMHSA dollars or the CDC dollars, right? So I'm getting back to this braided funding, each strand of funding covering different parts of the project and helping us sustain this work long term.
Ditto. Yeah, same process, different funders, but that's exactly how we at Gwen's Girls and the Black Girls Equity Alliance have been able to continue the work and, through, support from our local county Department of Human Services, but then also Sara and team from the University of Pittsburgh got an NIH grant to help with evaluation of one of our projects. So it's always looking for other opportunities and continuously looking for other opportunities. But I also want to, just echo what was said earlier about having partnerships that coexist or pre-exist any funding application. As I mentioned earlier, we were a group of fellows in a cohort with the Robert Wood Johnson Foundation, and we actually had a chance to see other teams that weren't as successful. And I think one of the main caveats of that either success or not being as successful or collaborative is the relationship. Before, not just applying or reaching out to a community partner because you want to apply for that funding, but already be doing the work. And I feel like that is what has sustained our work over 10 years with Sara and Brittany and myself and others, and that's the other piece I didn't talk about, is all the different partners that exist, that every month we have different now called action teams that are addressing the inequities that in the various areas. But if it wasn't for the collaboration, that this work would not continue. And it's about relationships with folks that really care about the work that we are doing that makes it also be successful. So, it is very, very important, that relationship, because it's about trust. And I think there was another thing that was talked about was being very clear on roles and expectations, and supporting one another and being able to have a process. That's one of the things that came up in the cohort, is having a process if there is conflict, because sometimes there are conflict, because every entity has, and you heard me say, we were two different universities that have two different policies and practices, right? So, and then here I am, the, community-based partner, and trying to figure out, again, what is equitable. But because we had that relationship and that trust early on and continued throughout, we have the work that it shows the work that's continuing to be done. So I feel like that's what has led to the success.
Okay. Thank you. Yeah, I'll just build off of some of those things as well. I think one thing that I think is really important to remember is that not all community groups, community partners, are the same size or have the same capacity, right? Gwen's Girls is a pretty well-established entity at this point, right? 20 years now. And even Equitable and Just Greater Pittsburgh has been here for 5 years. And even for organizations that have been there for a long time, there are ups and there are downs. There are times when the staff is stronger. There are times when things aren't going as well, right? And I think it presents a challenge for community organizations, community partners on a lot of different levels to work with funding organizations, and even in the universities too, right? Because there's just coming from different capacities. And so when we think about things like braided funding, it can be a challenge for organizations that aren't as established, who don't have the capacity to really think about what happens next. Or when we're thinking about sustainability, what happens next, when we're thinking about how we can leverage what we're doing to do something else, because there might not be the actual time to be able to dedicate to getting those additional resources. So I think that's one challenge with this all. I think it's super important, and it's really helpful when we have university partners who are willing and able to help for those reasons. And I think it's great, right? It makes it happen. It makes it be able to be sustained. And there are, of course, challenges with working with universities as well, right? Dr. Elliott just talked about working with 2 different universities, and working with one university can be a lot sometimes too, especially when larger universities have multiple ways of doing things within the university. And so it's a lot of those little things that don't go into the consideration when developing the proposals for these things, the things that Chris was talking about too, about the not having all of that evaluation about, or understanding the research about what's needed for the community partners in the process, right? Because there's a lot of this background work that has to happen in order to make the funding and the project possible, even at the community partner level. I will say that I think one of the things that we've tried to do on the AmeriCorps grant, and one thing I've been really grateful for, is just our ability to pay for so many different things and bring in so many different people as part of it, right? So one of our goals on this project was to make sure that everybody who was involved in this project in some way was compensated appropriately for their time. And that is not just monetarily. I don't remember if we had to figure out, there are always workarounds, I'm learning, to this. We will figure out a way to make it happen. So I don't know if all of this came from AmeriCorps or if it was a workaround through Pitt, but we've been able to make sure that people are fed and not fed pizza. Mm-hmm. There are substantial meals at all of our events. One of the challenges with our advocacy and organizing training is that we're bringing people from across the county together And we try to do in-person events. Not all of them. We do some in person, some online. But when we're doing them in person, we have to get people from different parts of the county together, and not everybody has access. And it's not, and some people that we've been working with on our steering committee and our participants aren't even well enough to leave their homes sometimes. They're coming out of the hospital or just having some problems and need to stay home because of health reasons. But we want their input, right? So we've been able to find accommodations, including for transportation, making sure that people can get there, or at least we are able to provide them some type of stipend to cover their transportation costs, also their childcare costs if they need one, which is another challenge, another thing that we always need to be thinking about too, especially when we're trying to reach the young adult demographic. Yeah, so I think there's just been a lot of things that we've been able to do, and thankfully we've had a lot of flexibility in being able to do those things.
Thanks. So, and I think a lot of what you were talking about gets us to our next question, which is, how do we sustain community partnered research beyond the initial funded time frame? Like, we've heard about how the relationship is so important to have before you get that funding, but what about when that 3 to 5 years of funding ends? How do we sustain that? This is a question for anyone on the panel who'd like to speak.
All right, I'll go since I'm holding the mic. I think one of the things that I'm thankful for is that at least in our AmeriCorps grant and our continuation grant, which is upcoming, hopefully, there's a specific set aside for dissemination, right? And I think in making sure that there's money set aside for dissemination and the support for the staff time and even our participants and steering committee to think through how we share out the message, how we share out this knowledge. And I don't think that's just about writing a journal article. That is about how do we share the story more publicly, more robustly, to really capture what this is. And in ways, what I want to be doing with that is to be able to think about how we can do that to leverage this work to obtain more funding to be able to continue this work. I will say one of the other things that's really important that it all enables is just about relationship building and making sure that we're able to continue the relationship, continue the work, and hopefully if we're doing a good job, those relationships will persist even after the funding runs out, and maybe there might not be another opportunity immediately, but maybe a year or two down the road that we can have the existing relationship all ready to apply for.
Thank you, Jason. Thank you, everybody. I just think two things. One, the partnerships, I agree, have to start before you apply for the funding, if possible. If not, you need to engage people in a really strategic way about the work. And Cecilia said something really important. The work has to be important to them. And it has to be something they care about, they're passionate about. And with the funding, it's so important to think about ways that you can pull yourself out, make your role as an academic researcher smaller, and theirs bigger, right? How do we do that? And even if you're applying for additional grants, one of the things that it's on the AmeriCorps project at least, and even with the other projects, is if we're going to apply for additional funding, let's ensure it helps sustain what we're doing and it becomes integrated within your work. Right? That integration within the work of the partner, and it builds their capacity, it builds on their vision, on their goals, and on what they want to do. And even with our small, we provide grants to all our community-based partners in the RECAST. How does this connect to your vision, to your work? How does it build on what you're doing? How can it actually further that? And we have students who who take the grant writing class at our school, and they write grants for them. They'll help them with that. I think we could do a better job. Actually, we heard from our other RECAST partner in Philly how they're doing that. And then we have in both of these projects, we have steering committees. And so steering committees with people that are county-wide that also help us think about sustainability and how do we further this work and what they need for that, right? our partners in each of the communities are on our steering committees, the former participants, all of that, we don't forget about them. They become part of the fold. They meet one another. We start to have these challenging conversations, which I think are crucial.
Yeah, I think it's similar to what I said earlier, but everything that you're saying is spot on. I don't think I have anything else to add to that, but just making sure that, we are, when we're projecting or planning to apply for additional funding, again, being clear about what the need is, because it may change based on we hope that it'll change based on the intervention that we have made, right? And so then making sure that we're informing the proposal and all, the goals and really doing, we still do logic models and, all those things to make sure that we are really focused on what the work needs to be and who needs to benefit from it. And again, 100% agree that whatever we're doing or whatever's being done, whatever the intervention is, it should be to empower that the people who are involved that oftentimes are not included in the work, that they are more included in the work. So I like that when you said, as more you as the university or the researcher are involved, the less as time goes on that you're involved, and it's more of the people. So for example, for us, my goal is to, if not next year, maybe the following, that instead of me sitting here, one of my youth that is being trained as a public speaker and to share their lived experience, that they replace me in this seat and be the ones that are speaking for their peers, right, and the work itself. So
just to kind of piggyback on a couple of things some of the other panelists have said, going back to this idea of dissemination, I think that is obviously very, very important. But what goes along with that is also this idea of translation, right? So it's not just writing the journal article and publishing that, right? It's also about making sure you're getting the information out there in ways that different communities are able to access it, but also absorb it and run with it, right? So yeah, if you're talking to researchers or academics, you want them to read the paper, right? But if you're going to talk to youth in a high school or middle school, that's probably going to be a hard sell to get them to read the research article, right? So you need to disseminate the information about what you're doing in other ways, right? So some of the other projects I work on will do things like, part of the intervention is to do a photo voice project where they are taking pictures about what the community could look like as a result of the intervention, right? So then what they will do to kind of disseminate that among the community and among youth is they will essentially have those pictures on display in a community center and provide food and transportation to get there. So that work is still getting out there and disseminated, but it's also translated in a way that's accessible to people that are not necessarily going to pick up the research article and read it, right? So I think that that's also important.
Can I add just one? Hello? Okay. So, early on, at Gwen's Girls, one of the things that will happen, we always get requests for students to come and to do their practicum or research project. And what was happening is they would come in and they would do an intervention. They would have great findings or whatnot, but then they wouldn't share it back with us, right? So we wouldn't know what was happening, right? And so that goes to, as an agency, I need to use that information to inform my practice. And so it's important that, I know hopefully people are not doing that now, and I know we put in a process where you have to, share your findings and even, come back in, even at minimum, and do a presentation to our staff around what your findings were. But just, it's very important that, and it's a trust thing too. Like we don't want to be in a space where people are coming, doing research, getting our information, but then don't give it back to us. So
I want to ditto everything again that everyone said here, but You know, I said at the beginning that this is a journey and this is transformational. And the reason why I believe that, both from working in this and watching all our fantastic grantees and all these projects and all the projects I'm learning about, is because it impacts so many people in so many ways, right? It's not just the lone researcher or the lone community member who's trying to make something happen. It is a group of people who are coming from different places, right? And so working together and really engaging and knowing there's going to be conflict of ideas and different perspectives, everyone's learning. So academics are hopefully learning new knowledge about the community or about the issue, and they're publishing what they need. Community members are learning research and how to tell their story in a more effective way to policymakers, to other foundations, to people who might care about their issue with reliable information, right? And people want to hear that in terms of where the needle is moving. New students are coming in, like your social work students, who are going to be able to see what it means to have these kind of relationships. And it isn't all, like I said, it doesn't, you know, people disagree. That's part of the technique, right? You agree to disagree. And that pushes people forward. And this kind of skill building does lead to new jobs, does lead to new opportunities for everybody involved. And so I think there's a scrappiness to this kind of approach where all of a sudden a door opens and you just got to get in there and do it. And so I think the idea of thinking through your logic model, knowing that there's an issue that's important to people, is of course crucial, but then it's just like the different opportunities that open up that you're thinking about. And hopefully, because it's a journey, like you said, what the issue was at the beginning might not be the issue for everybody, you know, 2 years down the road. And so what other opportunities are come up from that? And so one of the things that we did when we first gave the 2018 grant is we did, I learned these researchers were doing ripple effect mapping. And it's a visual way to really think about outcomes. And you bring different stakeholders in a group and you say, okay, you know, we started here. Where did this go? You know, what kind of ripples happened for you as a person involved in this project? What did it do for the community? And you really see where those things have gone. And I do believe, after seeing this for so many years, that there are wonderful ripple effects. And so part of the sustainability is not just the money for that particular work, but it's again, the collective and figuring out like the growth that happens for individuals and the group as a whole. And so we've seen, you know, yeah, more grant funding. It starts with the little seed funding. I've seen people get $1 million NSF grants. I've seen people get CDC grants, NIH grants from this work. I've seen community members who just didn't even know what this was, get involved, and now they're sitting on different city councils and really advocating for their community and become mental health workers and peer workers. So like, you know, I just see that there's just so much more to this than just publishing a research article. And so I think that's where the sustainability is more than just that one project.
And I'll add sort of this concept that may be helpful for some of you, which is research reciprocity. So this is a concept, right, that rather than the history of really extractional research that you heard Dr. Elliott speak about, and like students who, you know, like airdrop themselves into community, do their project, and then leave, and have never like really left, you know, like certainly even present the results, but that we actually start with relationships and not projects, but one that is, you know, built on mutuality and transparency and respect, so that reciprocity starts with like, how is a partnership like this helpful for you, right? And the answer from our community partners, as Jason was pointing out earlier, community partners come from lots of different places. The size of organizations vary, the diversity varies, and so we can't make assumptions as scholars in this space about what it is that our community partners are interested in and what draws them to the partnerships without asking. And so this concept of research reciprocity may be helpful as something that sort of summarizes a lot of what is being talked about, which is if we are much more transparent about the relationship and what we're getting out of the relationship, it also prepares us for those opportunities, right? Because if you're always thinking of together about what are the challenges that we're thinking about, and our community partners recently in the project that Dr. Ohmer, Dr. Beery, and I are working on are like, we want to have some kind of certificate, some kind of credential, some kind of way to show that we've been part of this work, right? So which has led us down a pathway around micro-credentialing and, you know, college course credit and so forth that we're exploring together. And, you know, that has actually become one of the things I'm really obsessed about now with research reciprocity is like, how do we do that in a really meaningful way so that everybody who comes out of the project gets something, right, that as well. So that just may be a helpful construct for us to use moving forward.
Thank you. So I'm going to skip ahead to our last question so that we have time for questions from the audience. But I will say the question I'm skipping was about how we ensure that community partners' time and effort is appropriately supported. And we've talked a little bit about that, and we can come back to that if audience has questions about it. But I'm just going to end quickly, and not everyone has to respond to this because we want to hear from your questions. But we were just thinking about as federal and local administrations change, how do we sustain and continue this community-partnered research under different leaderships and priorities? I don't know if any of the panelists have thoughts, and if you don't, we can go straight to
You know, I actually will say that this is why you do relationships and not projects, right? If you lead with relationships, then our ability to pivot is like right there, right? And so I will say that a lot of in the past year, sexual violence prevention work, we have been very, very mindful about integration of emotional health and well-being and tapping into adolescent mental health dollars, right? Knowing that that is a much more sustained source of funding. And we can do that because we've been in relationship with each other. And so that pivot, we can have very transparent discussion and do. So I do think at the end of the day, it's still about relationships and not projects.
I think, I think at CDC, we are no stranger to change. I think every 4 to 8 years, some sort of change in leadership and priorities. And I think throughout that, just consistency, there's been just a commitment to the core values of what CDC does, what the Injury Center does, and with that is sustained throughout any change. Some of the priorities may shift slightly, but we're still committed to, here at our center, at the Injury Center, prevention of injuries. And I think that's, as this work, this building of the community partnership, the relationship is so important. The dissemination and translation is so important to demonstrate what is going on with this work, that we can tell these stories and we can demonstrate the need and the impact and just the work that is coming from these opportunities.
I think one thing I'll add is that in some cases, I think with any funding situation, it's about tailoring the language to the actual opportunity, right? And in some cases, because it is about the relationship and because it's about like the core values at the center of the work, we might need to adapt how we talk about the work that we're trying to do to accommodate different leadership changes, funding opportunities. We don't need to say the particular buzzword to still do that particular work, right? And so I think that's something that I'm going to be keeping my eye on. Running a network called Equitable and Just Greater Pittsburgh might just have to change to like Happy Sunshine Pittsburgh or something like that. But we'll see. It's a goal. It's a goal.
Just use acronyms. That's it.
Yeah. But thinking about that and thinking and just being adaptable and flexible, and I think having those relationships and an understanding not just of one need, just of the complexity of the issues that are involved, because maybe there's not an opportunity in one area, but at the same time another door opens up around another area. It's like, okay, let's shift to that, and maybe not leave that completely, but shift more in that direction to prioritize that at the moment, and still work towards the one common goal that we all share.
Yeah, just be very nimble and willing to change and willing to think creatively and work collaboratively. And you can, I mean, I think all of you can raise your hand, have been through different leadership, right? Changes and different kinds of systems. And you have to really, it's the relationship. And even with those systems, to go and meet with them before you even ask for any money, to talk to them, to get information, to say you want to learn from them, helps tremendously. So,
All right, let's open it up for questions, comments from you all. So please come up to one of the two microphones on either side and let us know what you're thinking about and wondering about.
Can you hear me? Okay, great. Thank you so much for this panel. I've been sitting back there as a part of your Amen corner, like, oh, like all of it has been so beautiful. It's really inspiring. And so a couple questions that I have. One, I have a question about mentorship, because I think the goalposts often move. And I think when we talk about relationships first, especially I identify as a researcher that comes from the communities that I want to serve. And so the relationships are there. And so sometimes we still don't have the particular types of mentorship that we need from funders, because there still might be a prioritization of certain like randomized controlled trials or gold standards, et cetera, which don't align with trauma-informed, participatory, social justice-based research and how we have to support healing while we are doing the inquiry. So I'm just really curious about mentorship and infrastructure. Thank you.
Wonderful question. Thank you.
So I explained how I came to this work is because I found someone who knew that work, and I glued myself onto her. But in our, I think there's so much different kinds of funding, and there's like the seed funding, and then there's the large CDC, SAMHSA, RCTs. But I think in terms of our grant, we really have the philosophy that this is not just for PIs and it's not just for community researchers, but we've really built in money for students and for other folks to learn and to be part of this. And so I do think that, figuring out people in your department who are doing this work and, starting to think about how to do this work together is a way to start that. But when I first started doing this work, and I was like, how am I going to learn this, And I searched really hard. But, just not giving up. And there's so many more people doing this now. This whole conference, there's just wonderful researchers and partners. But also, being able to start your relationship with the community partner and go to a great organization and say, I want to work with you. I just don't know how, I come with some resources, I come with some knowledge of doing research. You have an issue, can we work together, And sometimes it's just figuring it out step by step. So anyway.
It was a good question, and it's a tough question to answer because we know historically some of the foundations and organizations, funders, go by specific protocols and things, but it's changing. So I can just talk about locally, like within Allegheny County and Pittsburgh, there are a few foundations that are very supportive of non-traditional pathways, right? So it's maybe reaching out to someone like that to ask some questions and to see if they can connect even on a higher level, because they do have meetings locally and nationally. And I feel like that's why the needle has moved, is because some of the ones that are being more progressive or flexible in how they fund and looking at their own strategic plan and strategies on giving, they are influencing and influencing the process. So how I had to go about trying to get money, and obviously again, ditto about the developing a relationship. You can be the best grant writer, have the best proposal, but if you don't have a relationship, you're not as likely gonna be picked to be funded, right? So it is that, but you still do have to have a sound proposal. But it is maybe looking at, in your local region, who are those funders that you know that are non-traditional givers, and then maybe asking them that question if you want to do state and federal types of opportunities.
I would say from our perspective, that is something we're trying to build into our notices of funding opportunities. We have, there's different types of opportunities available for different types of research. So something that we sponsor is called a KO1 Mentored Research Award. And one component of that is you're required to have a primary mentorship team to support an early stage investigator in their research. And that's more, I think, open to some of these other research approaches. We also have our, we mentioned our cooperative agreements that are a partnership with CDC scientists and the research team. And then there are investigator-initiated research awards that CDC is more hands-off. And so it's all about that justification of the approach that will meet the NOFO. And then in some of our NOFOs, we have like with the we support larger injury research centers, and so we have the ICRC's Injury Research Control Centers and the Youth Violence Prevention Research Centers. A core component of each of these awards is a training and mentorship program that is built in. It's one of the requirements and pillars of these awards that has to be, it's expected to be ongoing throughout the life of funding.
The other piece is you're developing a mentoring network is for those of us who are embedded in academic institutions. There is a mechanism to have people outside the university serve as your mentors, which includes community partners. So actually, Dr. Elliott has been a community mentor for several of our scholars, and we have set up mechanisms to pay community mentors for their time as well. And so again, being very mindful of equitable compensation, but community mentorship, mentorship from people outside academic institutions is so critical, and think about how that helps transform our own institutions by having community members on those scholarship oversight committees and your mentoring, meetings and so forth, including your KO1 submission to the CDC, including this person's going to be my community mentor is a way to signal, right, that you're really thinking about building community partnerships into your work.
Other questions? Yeah, please come up to the microphone. Thank you.
This was an incredible panel. Thank you. I'm a grad of University of Pittsburgh for undergrad and business school, so shout out Pitt. I am a first-year PhD student at University of Southern California in the gerontology program, and thinking about a lot of these things, including the previous question. But my question centers more around the burden of reporting. Everyone sort of has gently touched around the requirements and how they communicate information to stakeholders. But as I think about the funders that come from very established agencies and have a lot of set criteria, where do you see the burden of reporting headed in the next sort of 5 to 10 years? And then from the community impact organization side, how do you handle the burden of reporting? Because what I heard today was that it's almost like you have to show you're ready to get the money, right? So when I think about that, have the partnerships, have a lot of things in place, well, what does that mean in terms of when you evaluate grants and think about, well, do they even have the capacity to continue with us for 3 to 5 years under our reporting requirements? And then for the community organizations, what does that mean for you as you engage in this current process, but then think forward when the funding begins to wind down and you have to pursue other opportunities?
This is a very good question. I think that is something that we're always cognizant of, the burden of reporting versus actually getting in and doing the work. That's not something, we don't want the whole time of the grant period being like, okay, I have to submit this, I have to track this and track that. No, we want you to be able to conduct the research. I think I have seen there is a big push as far as simplification, and so we see that we rolled out a simplified NOFO template last year as far as the application itself. The NOFO language was very streamlined, and so we're going to be transitioning to that going forward to cut down on just the dense text of what's all in our NOFOs, and so it's just clear and simple to read. And I see that trend with the an expected simplified grants.gov website to actually search for and identify grants. And so I see that as a trend. I can't make any predictions of what that's going to mean for the actual grant reporting, but I do see a move to that. And I know just as a program officer, I am very hesitant to ask for things that are not an actual requirement of the grant, because I recognize like it is burdensome and you are busy conducting the research and establishing partnerships, and that's where we want the focus of your time and effort to be, not submitting yet another report.
To add to that, just from the science officer perspective, as somebody that works with lots of researchers, I would also just like to highlight that the purpose of reporting, at least for people like me who work with researchers, is so that we can communicate up, and that eventually gets to, in our case, Congress, right? So sometimes Congress will reach out to CDC and say, hey, we gave you money to do this type of research. Can you tell us some of the things that the people or the researchers that are getting the money have done or found as a result of that funding, right? And so while I certainly understand and empathize with some of the challenges with reporting, I also just want to highlight that the reporting helps us make the case so that you can keep doing the work, the communities can keep doing the work, and we can all keep growing together.
Absolutely. Like I feel like a used car salesman every year when I'm knocking on doors and asking our AmeriCorps programs to fund our research grant program, and they go, well, how does research relate to, for those of you who do service, being a VISTA at an organization? And so I have to work really hard at talking to our programs and explaining to them how funding research for us as researchers, we're excited that participatory research actually makes impact on the community. But it's hard to explain this to our programs whose mandate is to do national service in nonprofit organizations. It doesn't make sense. So we spend a lot of time translating how doing the work in Pittsburgh can lead to a handbook that we could give to all the VISTA organizations to look at how to do equitable development, right? And so we have tried very hard to keep reporting to a minimum, but there are just basic rules in place that it just has to be done. And we have an archaic, horrible grant system, and we're always so honored that our grantees don't just tell us to go to hell. But it's just part of it. And so we're always open to feedback, but we have regulations that we have tried so hard to minimize. But, like you said, it helps tell our story to Congress. And right now, with this change in administration, we're being asked lots of questions. And what I'm bringing to the table is all the wonderful research that's been done. So if that reporting is in my, I could look at it in our reports, I could grab what I need and bring it, and that just helps tell our story.
From the community provider perspective, we've had a few federal grants, and there have been changes over the years that have been for the better, but it was like mid-grant, right? So then we're like, I've already trained and had my staff understand what's required, and then now we have to do something different. And so that's where the issue comes in. The limitation is the capacity to do the data collection and reporting, which usually falls on me. So, or even if we have a partner that we might contract with to help to manage that particular grant or whatever, we'll do that. But it is a push, but we do recognize that this information is needed, because you can tell just based on how the spreadsheets and the what you need to answer is that they're trying to populate and understand the numbers, which again sometimes is frustrating because we can look at the numbers. A lot of times people want to look at quantity and not quality. And so a lot of times the reporting does not capture the quality. And then I want to go back one to one of the last questions around the mentorship, and something that was said I was going to bring up, but I think it's important, especially for a community-based organization. If you don't have a relationship with your state rep and congressman, you need to, because again, that's how a lot of this information, or I just probably last year learned about appropriations and the monies that they get at their discretion to give to whoever they want to give it to. And so I need to be one of those people, and so do you if you need the money. So know who your people are in your district.
I think one thing, or a couple things about this, I'm drawing a complete blank. What were we just talking about? The reporting. Thank you. About reporting.
He wants to give me money.
Yeah, if I had some, I'm so distracted.
Help me get money.
I think one of the important things about reporting is, as in doing this work, remembering that there's a distinction between what needs to be reported for fundraising or for grant reporting requirements, and then there are also research requirements, which are different from those. Or you want to make sure the research is good quality and good fidelity and all of the aspects of the research project, and those two things don't always align, right? And that's what I think, quality, right? And so I think it's really important at the beginning of any relationship that you're building is to have clear understandings of roles and expectations with if you're working with the university, who the university partner is, or if you're at a university working with a community organization, about these things. Who's responsible for collecting what data, who's responsible for analyzing what data if it's a research project, or maintaining what data. And it's really important to think about that as you go, as you're building that relationship and starting to put proposals together too. Because I'm thankful that on our projects we have staff who can help with that. Thank you, Donnell and Alex, who are in the audience today, who can help keep track of those things, right? Because if you're not thinking about those things when you're putting the proposal together, you're not going to have that staff time allocated when it comes time to actually do the reporting. And then that becomes another way in which the burden is a lot greater than you expect, right? That way, that's why it all falls on Dr. Elliott, right? Because of those changes that come up midway and things that mess things around. And so it's important to make sure that that's clear and that we're accounting for that at the beginning, and really understanding all of the dimensions of the grant, not just the programming.
So before we finish and say thank you to everybody, I just want to make sure everyone's aware that we have awardees on the stage for our new Community Research Partnership Award that I helped to create with a lot of really good people at SSWR. Dr. Sara Goodkind and Dr. Kathi Elliott are our inaugural winners of the Community Research Partnership Award. So please come to the award ceremony. I'm going to let Sara wrap it up and say thanks.
Yeah, well, thank you all for attending and engaging with us, and thank you panelists for, I think, a really thought-provoking and helpful conversation. And feel free to come up after the panel and chat with anyone that you didn't get to. So thank you, everyone.